Welcome to AFD TV. I'm Dr. Steve Samadrala. I'm here again with well-known neurosurgeon Dr. Sana Dixit and Bree. So we have another follow-up today on Bree's story. So take it away, Dr. Dixit.
Bree, we keep having follow-up, you and I. I'm just like, what's going on here?
Well, when I was very young, I was in a car accident and I jarred my head against the dashboard of the car. And since then, I've had neck issues on and off where my neck will go out and I get stuck like this. It's very painful. And so I see a chiropractor on a regular basis to try to prevent my neck from going out, try to keep it in alignment.
Okay.
So my question to you is, as I'm getting older, I've kind of started researching surgery as a permanent fix, a permanent solution on this, so I don't have to continue seeing a chiropractor and I don't have to worry about it getting worse. Is that something that I really need to consider, or what are your recommendations?
That is a great question, and that's a question that pops up a lot in my practice. The first thing I tell most of my patients is there's no automatic surgery for neck pain, there's no automatic surgery for back pain. In all honesty, it's probably best avoided. The biggest issue is figuring out where your pain is coming from. I think it's great that you were seeing a healthcare professional about your neck pain. Chiropractors do a wonderful job in helping to manage some of the symptoms. We want to make sure that we get to the bottom of where your pain is coming from. So establishing a correct diagnosis is the first step. Second step is doing some of the things you were doing with therapy, with medication, to try to alleviate some of the symptoms. I reserve surgery for people who have problems with spinal cord compression, spinal nerve compression, neurologic symptoms. Surgery can also be considered if there's a structural abnormality where there's an instability in the spine. And I don't think that's what you're going to end up dealing with primarily. So for you, just hearing what I'm hearing right now, no, I don't think surgery is something that you want to look at aggressively as a permanent fix, because I'm not sure it's going to offer you a permanent fix.
Okay, thank you, Dr. Dixit.
Sure.
So if we don't do surgery, what are the other solutions that you think?
The other solutions, well, she's seeing a chiropractor, physical therapist, primary care physician. It's really going to be a program. Managing neck and back pain is a continuum. It's a process, and that's something you engage your patients on, educating them and following up with them. So it's going to be doing more of the same things that you're doing right now in the hopes of trying to quiet down some of the symptoms that you're having.
Have you been to physical therapists ever?
Yes.
You have. And what's your experience for physical therapy versus chiropractor for some of the issues you've been facing?
Well, physical therapy, we worked on strengthening, building up muscle to try to keep that alignment in order that way. With the chiropractor, I've seen different types of chiropractors, ones that used the tool that, I don't remember what it's called, but it's a thumper tool is what I call it. They don't actually do any manipulation with the neck or head or
Which
back.
is scary.
Yeah, because I have seen those types, and you have I call it the Arnold Schwarzenegger adjustment.
You better make sure they like you before they...
So that way definitely is nerve-wracking, but I've found relief in every method, and maybe just a combination of all of them has been the best.
What about dry needling?
I think that's a great modality. I think all of those non-invasive therapies are appropriate, especially if most of the pain is coming from sore stiff muscles, which in my experience where a lot of the pain is coming from. It's musculoskeletal, myofascial type pain, and the way Bree's been managing it is the way I would usually recommend managing it.
Well, as we know, you started off as a ballerina.
Right.
Right. And a lot of times ballerinas tend to be kind of petite, small bones. And do you find issues when people have smaller bones with long-term osteopenia or more pain? Or
No, what I find the biggest issues are people who may have a smaller skeletal frame and are carrying probably 30, 40, 50 extra pounds, because that's where a lot of the pain is coming from, just from carrying all that extra weight.
And what about, what's it called? When you do have those smaller bones, but you've been very active as a dancer, cheerleader, things like that, do you see more issues for people who were athletes in the past?
If you're involved in something that's contact or with a lot of repetitive movements, you're going to see more wear and tear. So yeah, there is a distinct possibility things may break down a little bit quicker in you than in somebody else, but it still doesn't mean that we have to even consider surgery as a first-line treatment.
Yes, in your history, you've obviously not done contact sports, but you've had a lot of repetitive motions in that area.
Yes, with dancing and being a professional cheerleader in the NFL, there were a lot of head whips and hair tosses, and that was when my neck was going out on a regular basis when I was still cheering and dancing, and actually since then it hasn't been.
Well, that's
bad.
good because you're a retired cheerleader.
Yeah. Taking it easy now.
and that's also a very important thing because everyone's always concerned about the football players, but what about the cheerleaders? I mean, cheerleaders.
It's rough too.
It's actually, I think it's rougher because you don't get the sympathy.
Yeah.
So well, very good. Well, now this is a fascinating topic. Well, thank you everyone for watching AFD TV.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Sam Yadrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.